Okay, Hariom everyone. So today we'll start with the next or last cardiovascular disorder, that is cardiac asthma. So my screen is visible and voice is also clear, na?
Yes, ma'am.
Yes, ma'am.
Okay. So what is cardiac asthma exactly? As the term asthma, we had studied this asthma term before also. In which disease? Can anyone tell?
Respiratory
Respiratory.
system
Fight.
disorders.
What?
Respiratory disorders, ma'am.
Yes. What is the name of the disease in which the asthma is involved? Like I told you. Yes. Bronchial asthma. Okay. So as the bronchial asthma, what is bronchi? I told you that the branches like structure is bronchi. So when the asthma and that problem of breathing is in bronchus, that is called bronchial asthma. But the similar symptoms or similar thing happening in something coronary arteries. Coronary arteries. Yesterday also I told you that which are supplying to the heart. Okay. So if the problem or the same condition in the coronary arteries, it is called as cardiac asthma. The same bronchial asthma and cardiac asthma. So what is cardiac asthma? We'll understand now. Cardiac asthma is a medical condition, same medical condition that shares some similarities with bronchial asthma, okay, or similar to it, but has a different underlying causes also, and it uh, like treatments are also different. So sometimes we also call it as a heart asthma because cardiac is itself the word which is related to heart. Pulmonary is the word which is related to which organ? Can anyone tell?
Lung.
Yes, very good. Okay, so sometimes called as harsh asthma because it have the similar symptoms to as that of bronchial asthma. Okay, there are many similar symptoms. We'll see ahead. So primarily associated with the heart failure, a condition where the heart is unable to pump blood effectively. So blood is unable to transfer the like heart this blood the heart is unable to transfer the blood appropriate amount of the blood which the body requires. Okay, so we'll now understand it because it is something related to lungs also and the heart also. Okay, so in cardiac asthma may be defined as the clinical syndrome induced by acute passive congestion or edema. Edema is something which is word only related to swelling or that inflammation type of thing. Okay, and some bubble like structure. I will tell you. Okay, some congestion or edema in which of the lungs. Okay, of the lungs. How it happens, we'll see ahead. So what is edema? Edema occurs when the tiny blood vessels in the body. What are the most minute one are the capillaries. Okay, arteries and veins are still a little broader than that of capillaries. Okay, capillaries are most minute one. So when these capillaries leaks their fluid, okay, where the fluid inside the capillaries comes out or the leakage of the fluid happens from capillaries, this condition which forms further the sac like structure filled with fluid or that liquid of the capillaries is called as edema. Okay, this is edema. So pulmonary edema or the fluid in your lungs. What is pulmonary? Again, the word for lungs. So pulmonary edema means that fluid full sac-like structure. That is
Excuse me,
pulmonary.
ma'am. A
Yes.
little slow, ma'am.
Yes. Okay. Up till this paragraph, you understand.
Once again, you start,
Okay.
ma'am.
So as it is told, it is defined as the clinical syndrome, which is a something you have to understand this word passive congestion, some obstruction, congestion, or edema. Edema is nothing but it is filled with some fluid. Okay, edema is like this. You can see in the diagram. Take another pen. Okay, so as you can see in the diagram, this is lungs. This is lungs. In the lungs, these are some sac-like structure. Okay, a fluid full. These sac-like structures are there. So this is called as edema. Okay, edema is nothing but it is filled with some fluid. Okay, what is that fluid? That fluid is of the capillaries. Okay, when the capillaries will burst or it will get destroyed due to this the fluid get covered in this sac like structure and get deposited in the this our liver, sorry, lungs, I'm saying liver, lungs, in lungs, where in bronchi, bronchus. Then again the person will unable to or will feel difficulty in breathing and all. Will further see that how it works. Okay, so pulmonary edema or fluid in your lungs. What it means? Pulmonary edema is a condition caused by too much of fluid in the lungs. Sometimes we used to say na that the person is having fluid in the lungs. Okay, या फिर we say that पानी भर गया उनके lungs में ऐसे type. So this fluid collects in the many air sacs. The same thing which I told you. This fluid collects in the many air sacs in the lungs, making it difficult to breathe. Okay, so this fluid goes inside the air sacs of the lungs. Definitely, if it is filled with, which should be filled with air, and it is getting with this water or fluid, it will be make difficult for us to breathe in or exhale out. So this is the pulmonary edema and the fluid in your lungs. Okay, this fluid comes from pulmonary hypertension. From where this fluid comes? Because I told you before also, this edema is because of the this leakage of the capillaries. Leakage of the capillaries are there, but how this happens? Because of the pulmonary hypertension. As I told you, hypertension, high blood pressure in your lungs. What is blood pressure? Can someone tell in that class, hypertension class I told you? Pulmonary hypertension, you can make me understand.
Yes, yes.
Force of
The
Yes,
okay, okay. Somebody else has started.
yes, tell, fast, fast.
force extracted on the force of blood extracted on the arteries, ma'am.
Yes, walls of the inner walls of the arteries,
Yes.
force that is exerted on the inner when the force increases, then it is called as hypertension. Pulmonary hypertension again related to lungs. So when there is pulmonary hypertension or high blood pressure in your lungs, which leads to pulmonary edema. Okay, so if there is some vessels are there, this we are thinking that it is a capillary. Okay, when the pressure will increase more and more, maybe it increase that much that it will be burst out. Okay, then it's liquid will come out. Okay, then liquid will come out, it will get accumulated in your lungs in some sac like structure, which will hinders your oxygen to come out or inhale in. Okay, so which leads to pulmonary edema, fluids in your lungs. This fluid make it hard for you to breathe in. This condition itself, when it is making you difficult to breathe in, and it will not be able to travel, like then our heart will definitely not going to supply the sufficient oxygen or oxygenated blood to body. This condition is called as cardiac asthma. Okay, there is, because it is something related to lungs itself. So what happening in the cardiac asthma? Further also we have something to study, but still we'll see. So what happens in cardiac asthma? Some congestion or edema like formation in the lungs. Okay, one point, first point you can write like that. In cardiac asthma, congestion and edema formation in the lungs. Okay, edema is leakage of the fluid. And what is like this leakage of the fluid, and what this happens? It is nothing but when fluid this when this fluid get collected in sac like structure inside the lungs, it will the air filled sacs are now filled with fluid, and it will hinders or it will be difficult for us to breathe in or exhale out. Okay, so this all breakage or leakage of capillaries, all this happens because of hypertension in lungs, therefore because of pulmonary hypertension. Okay, which further leads to edema formation, because lots of hypertension is there, like much pressure on the walls, the capillaries will burst out, further release of the fluid will be there, will get accumulated in the form of fluid sacs, and results in the blockage or inability to breathe in or exhale out. Such condition will lead to cardiac asthma. Okay, so now we'll go next. The heart can't properly pump blood. In cardiac asthma, what happens? The heart can't properly pump the blood out of the left ventricle, because left ventricle is something which is supplying to Which part? Left ventricle is supplying to,
Aorta. Aorta.
and through aorta to whole body.
The whole body. Yeah.
So here it is told that the heart can't properly pump blood out of the left ventricle, or the pressure in the ventricles is high. So because of the high pressure, the proper amount of blood is not entering, going to the body. Okay, proper supply of the blood is not happening. Exact word is like they want to make explain this thing. Okay, this disruption in blood flow, like this balance in this blood flow, leads to increased blood pressure in the blood vessels of the lungs. Blood pressure will increase, which causes leakage and accumulation of the fluid. This I make you understand in before slide itself. Maybe this is very much clear to all. If any doubt, you can ask. So we'll, okay, last we'll see this slide also, then you can ask your doubts. Okay. So this cardiac asthma occurs when the left side of the heart suffers from the sudden disproportion or disturbance between the workload and work capacity. What do you mean by this workload and work capacity here? Workload is what exactly the body is demanding for. Okay, that is the workload, because that is the something heart have to do. Hmm. And what is the work capacity? What is the capacity of heart at that time? The heart is unable to do or fulfill that requirement of the body, requirement of blood for the body. So that is, it is said in this line that there is imbalance or disproportion in the workload, what the heart should do, and work capacity, what is the capacity of heart to do. Okay, which leads to heart failure. For the heart failure doesn't, here heart failure doesn't mean that person will die or heart start is not working at all. It means that the heart can't keep up with your body's demand for the blood, that I told you before only, that it can't meet the actual demand of the body for the blood. Okay, hopefully you understand. If in doubt, you can ask, and all are clear. My voice is audible. Hariom.
Yes, 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 ma'am.
Yes, ma'am.
Any doubt? Anyone you can ask. No doubts. Is it clear?
Yes, yes, ma'am.
Sure. Okay.
Yes, ma'am.
So now this, if any doubt, you can ask till. Okay, I have want to complete this disease. Then you can ask the question. That's why I'm saying that now exact what is the disease I completed with. If any doubt, you can understand, make understand. Otherwise, I will tell you again to summarize you that what is cardiac asthma. So cardiac asthma, where is pen? Yes. What is cardiac asthma? Cardiac asthma is nothing but when in the diagram, when what happens in our lungs itself, there is some congestion or some in simple word you can understand, or some obstruction along with the edema. Edema is nothing but a little bulge like structure, or sometimes in simpler term we also call it as a swelling, but it is not exactly swelling. It is something which is filled with inside it. Okay, so some you can understand fluid fill sacs like structure. Okay, when congestion and this edema formation happens in the lungs, which further will give the will hinders the oxygen travel, or breathing will become much difficult for us. And this this is happening, okay, difficult for us, then our heart will not be able to meet the actual demand of the body for that oxygenated blood. Whatever the amount of oxygenated blood our body is asking for from the heart will not able to give it, because oxygen is not coming properly to heart also through the lungs, as we understand in the heart, as we understand that from this your right ventricle it is going to the lungs, from lungs it is going through the to the this your left atrium. So when there is, when the deoxygenated blood heart is giving to the lungs, but in lungs as no proper exchange of gases is happening, because of that congestion and formation of that edema, because of these two things, no proper exchange of gases are able to happen inside the lungs. So therefore the heart will not be able to take the proper oxygen, and will not be further able to travel it to the body. Okay, therefore how much or what is the requirement of the body for the oxygenated blood is not fulfilled by the heart. Okay, and this such condition is called as cardiac asthma. And why these edema formation happens, condition is okay because of all the reasons we have studied before. But why edema forms? Because edema is nothing but fluid full. So from where this fluid, you can understand, like with this series you can understand like a story. Okay, you can understand this because it is fluid full. So from where this fluid is coming, it is coming from somewhere from inside the body. It will coming from the vessels. These vessels are the smallest vessel, those capillaries which can easily be broken down. Okay, broken down. So when the heart this your pressure on the walls of pulmonary arteries, when the pressure will increase, then these can be burst off, which we call as pulmonary hypertension. These will burst off, so their liquid will come out. The liquid will get accumulated in one sac like structure, which is called as edema. Okay, so this is how edema and congestion in heart, in lungs, in lungs region happens, and further difficulty for the air to go into the heart, and further heart is unable to fulfill the requirements of the body, and this condition is called as cardiac asthma. Now understand, I summarize the whole.
Yes, ma'am.
Yes, ma'am. Sure. Okay. Now causes. You see, cardiac asthma is typically caused by the congestive heart failure. Nothing but again, congestive heart failure is nothing but same, not fulfilling the demands of the demands of the body. Oxygenated blood is not fulfilled by the heart. Okay, in heart failure, the heart's ability to pump the blood efficiently is compromised. That means it is not fulfilled. Okay, what demands for the oxygenated blood. The same I told you before also, that is only the cause. So this accumulation of the fluid can cause the airways in the lungs to narrow down. Of course, as accumulation of fluid is happening, so like this, if edema formation in the this is bronchus, we are seeing edema formation. Of course, it will narrow down the passage and it will show the symptoms similar to asthma. Therefore, it is told that this cardiac asthma and bronchial asthma have very similar symptoms, because same thing happening, problem again at the pulmonary part only, which leading problem to heart, further to the body. So therefore, it is similar symptoms. Okay, other causes are age factor. These are normal. Okay, age factor, valvular heart disease. If any problem in the walls of the heart, which is walls, when see in this, I'll show. Ah, here there are walls. Na, who will tell that how many walls are there on the right side and how many walls on the left side?
We have tricuspid, and on the left we have mitral bicuspid.
On which side bicuspids are there?
On left.
Left
Yes.
side.
Why? Someone can tell why?
Um, um, because it is the channel through which the blood has to flow out, and naturally there is a downward flow.
Yes.
And in the ventricle, because the blood has to come up into the heart and it has to go to the lungs to get oxygenated. There
No,
is a
why this is tricuspid and this is bicuspid. Okay, I'll tell. There is tricuspid because it is coming deoxygenated blood. Okay, so deoxygenated blood, so it have to take inside. So it is more difficult or more workload is required. Okay, and in bicuspid, it is oxygenated blood again, so it is less required. More workload on the this one. Therefore, a little size in size also. If you see the this one, your right ventricle is a little more, like its walls also are more, if you study deeply, its walls also are more broader, okay, than that of other one. So this is not only a syllabus, it's time for telling purpose. Coronary artery disease also can lead for because again they're narrowing down of the passage there also, again can lead to irregular heartbeats such as faster heartbeats. Who will tell? By myself itself, like knowingly I kept it like that.
Palpitation.
Yes, very good. Drinking excess alcohol, drugs, genetic, this the normal symptoms. Anemia is when there is deficiency or lack of blood. And high blood pressure, of course, this is the main cause. Symptoms, common symptoms of cardiac asthma are
Ma'am,
this.
can you go back, ma'am?
Yes, ma'am. Okay. I'll send you slide now only. I sent same day only. Just yesterday's slide I sent today. So can I go ahead?
Yes, yes, ma'am.
Okay, symptoms. So symptoms, as I told you before, also it is very similar to have same symptoms as that of your bronchial asthma. So this is coughing, wheezing, same there also, na? Coughing, wheezing, shortness of the breath, especially at the night and lying down position. Why? Because in lying down position, what happens? The person may lie down. In it is told, it is said that we should lie down from the left side even after eating food, and normally also we should go for the left side lying down. Why? Because then workload for the heart is normalized. If we go from the right side, the workload increase for the heart because it is on the left side now, so again to travel that. Okay, so therefore normally it is said. Feeling of the tightness in the chest, of course chest pain will be there. Again and again coughing, wheezing will result into chest pain. Fatigue, laziness, and all this could be the symptoms also. Okay, these symptoms can trigger or worsen by the physical activities or lying flat. In any condition, in lying flat also, because some when we lie down flat with the head up and like that also, it also pressurize on the heart. Therefore, for the proper position, I told you na, we should go for the lying down from left side. While sleeping, after eating food, also we when we lie down, we should go from the left side. Okay, so like that it could be happen. With this is completed. We'll go for any doubts in this cardiac asthma.
No, ma'am.
Okay, so now we'll complete today our this cardiovascular disorders. So we'll go for last yogic management for this cardiovascular disorders. So again, as I told you in starting, it is very easy for you all now, I think so. If you have a little knowledge of asana, pranayam, and mudra, what we should give them. So with the whole module, with this same pattern, you can go integrated approach of yoga therapy, as I told you before also. So with all the koshas will work. Uh, First, we'll see Annamaya Kosh again with diet. Normal in all the diseases, it is common. Okay, normal, but in some it could be specific. Okay, normal sattvic food, green vegetables, etc. Cough reducing food. Why here also again cough reducing? Because in bones problem. Okay, something which is related to your bones or arthritis and all, you will not go for this cough disease. Okay, then we'll see again it will be changed. Then here again cough, because again the deposition is happening, blockage is happening due to those depositions. Okay, avoid rajasic and tamasic foods, all the diseases. Okay, now shithalikaran vyayam normal. But one thing you should take care that forward bending should be avoided in all the heart related problem or cardiovascular problem, because it pressurizes our heart. Person, I told you in starting only that the main cause or most common or most like this will definitely going to happen if the person is having heart problem. What? Hypertension. Okay, hypertension is main cause. First hypertension will happen, and then further the disease, it could leads to further diseases. Okay, so when we bend down, the pressure hole comes towards the heart region or the upper region. Then it can increase, if the person having cardiac problem, can increase the pressure on the heart, or blood pressure could increase. Hypertension could blood pressure could increase, which will be problematic for the person. So forward bending asanas practices should not be given to cardiovascular diseased person. Hand in and out breathings are normal. You can see what we have to do in this. Hand stretch breathing, up and down, and then tiger breathing. In Marjari Asana, we also used to call it as Marjari Asana. In lying down, toe bending, ankle rotation. These are all very simple practices. In these are for like in warming up type. Then yogasanas, what we should go for Adhikati Chakrasana again because it will effect. We should go for the stimulation of that reason where the problem is, but should not pressurize that. Okay, so Trikonasana again, everything which will help for this. Your Vrikshasana, Setubandh in Vrikshasana also in cardiac problem we go for Vrikshasana with wall supports. Okay, with wall supports. Then also Gomukhasana, something Gomukhasana if person can do in sitting, it's very good. If problem, we can go for chair Gomukhasana. On chair sitting, bend your legs. One leg is down, one leg you have to bend. Okay. Then twist your body like mm, sorry, go instead of this Gomukhasana also very good because chest expanding is there, but not legs up, but legs both legs down only. In Gomukhasana, only hand practice you can do, which will again like expand your chest region. Then Setu Bandhasan, course. Vakrasana that I am telling you on the chair again, you can go with Vakrasana also. One leg up and twisting you have to do. Okay, Ardha Matsyendrasana, all this which are expanding your chest and stimulating your this thoracic region, but not pressurizing it because the main cause is if the person is unable to do all these practices, it's okay. No need to like force him if easily can do. Okay, the person should go for more practice of pranayam. That is also very good. Okay, pranayam is main. Okay, then kriya jalneti we can give them, but LSP, that is Laghu Shank Prakshalan, but we should avoid the Vamandhoti again because pressure will increase in the upper region, and Sutneti because in Sutneti also what happens, the pressure increases. But if person feel good with Jalneti, it's okay. If again the more pressure, newcomers also are there na, for newcomers in Jalneti also they feel too much pressure. Okay, so we can avoid that also for them. LSP because normal LSP could be done with 2-3 glass. Laghu Shank Prakshalan it is. So no need to give too much. Then again, cleansing will happen. So in Pranmaya Kosh, we'll move towards next. Nadi Shodhan Pranayam, of course, will not go. So you have seen that in Kriya, we are not giving them with Kapalabhati. Okay, so always make a note that we should not go for Kapalabhati for all those this one cardiac problem. Okay, it will pressurize it again. Yes. Now, Pranma question, Nadi Shodhan, sectional breathing. I told you in first management also that sectional breathing something which is related to upper region, clavicular, thoracic, and abdominal breathing. Okay, these three breathings involved. Okay, one by one we can do. Okay, then all together also. Okay, for in all together one that we call as full yogic breathing. Okay, then Brahmari, again, vibration will leads to the release of that blockages. And then Laya Pranayam. Laya Pranayam is nothing but like a Nadi that we do Nadanusandhan type of. Na normally we can't do like that. So no normal condition we use to do this chantings. Okay. So while chantings, Nadanusandhan happens like Akara, Ukara, Makara, or Auma all together. And then Manomay Kosha, and then it is written the names of the meditations we used to give at the mainly it is cyclic meditation like we see SVSA technique. Okay. In this, 8 steps are there. Om meditation also, meditation, meditating on the Om, concentrating on Om, then going deep to Om, its nature and all we are adopting like that. It is meditation also there. 45 minutes practices are there. So I just named or other meditation technique I told you in starting also. If the person don't know any meditation technique, can go for only sitting down with closed eyes and concentrating on their breath. Okay. MSRT, this is mind sound resonance technique. This is again the which is related to chantings of Uma separately, Uma all together, and Mahamrityunjay mantra. Okay, you can see your last unit also there These all are there. So you can ask from them. The teacher will teach. Then Vijnaname Kosha. Like I know this, I give these practices to there, and I'm also from SVASA, so I give these practices, but still here it is that much required. So I told you this. So now Vijnaname Kosha, that is something related to your mind, sorry, something which is related to your buddhi or intellect. Lectures we have should go for yogic counseling. These are same for all these mostly. Okay. Satsangs and all, because we also give them some we also touch the part of bhakti yoga for them. Okay, so that because in satsang also, when we used to go some chanting something, at the time of the chanting the breath stops for that few seconds, further again we inhale and exhale, so this will increase our respiratory rate, or increase our this thing. Okay, our capacity of our body systems. Then awareness programs for about awareness about the disease and how this disease could be cured with yogic management. Okay, how we are working in all the koshas, how it will work. Okay, like that. Anandamaya Kosh, again, happy assembly. In happy assembly, we used to give them games and all. I told you before also. Then karma yoga, they have to ask them for doing, like explain them about karma yoga. Normal. Now it is completed. If any doubt, you can ask. Otherwise, with this, our cardiovascular disorders are also completed. Respiratory disorders and cardiovascular disorders complete. Any doubt?
No, ma'am.
Okay, few people have don't have doubt, then I will have doubts. Okay. If any doubt, you can ask.
Ma'am, full form of the MSRT
Mind
meditation.
mind sound resonance technique. Because resonance is happening, all the meditations and chanting, what is happening exactly, the resonance happening too, while this resonance or while these vibrations, it is that vibration of the external environment, we are creating the this vibration in the environment, the vibration of frequency of the external environment, or these chantings are meeting the frequency of our inside our inner body, okay, eternal self. So when these two meets, our body feels relaxed and all these what we exactly want. Okay. So now, should I ask the questions or for 5 minutes? If you all are not too much tired.
You could, ma'am.
Okay. So who will tell that what is allergic rhinitis? Who will tell? Raise your hands. Okay, Sangeeta ma'am. Sangeeta ma'am, are you there? Anita ma'am, okay, tell.
Allergic rhinitis occurs during
What?
it's also what to say, it's like specific allergens, mama, like seasonal allergy. It's also called hay fever.
Okay. Um, who will tell more? Aarti ma'am?
Yes, ma'am. Uh, Inflammation in the nasal membrane due
Okay.
to the allergens.
Which membrane of nasal? You can you name?
Mucous membrane.
Yes, mucosal membrane. So who will tell what is sinusitis, Sangeeta ma'am? Sangeeta ma'am?
Sinusitis, the sinuses that we have, the four pairs of air-filled spaces around the nasal cavity that we have, it gets inflamed. Inflammation in the sinuses. This is
Okay. How many types of sinuses are there? Who will tell? Anita ma'am?
It's four types, mama.
Okay. So, okay, good. Hmm. Now, sinus, yes, this allergic rhinitis. How many types of allergic, what is the classification of allergic rhinitis? Who will tell? Okay, tell. Aarti ma'am.
Yes, ma'am. It's four types: seasonal, perennial, uh, sporadic, and occupational. Seasonal is according to the season,
Okay,
and
okay, okay. Okay, what is sporadic, Sangeeta ma'am?
Sporadic, it is intermittent. Um, then and there, there is no any pattern for its occurrence.
Okay, okay. So, what is occupational? Who will tell? Uh, yes, Sangeeta ma'am, you will tell. Complete this one, you. And last
Um,
one.
Occupational, so from the workplace,
Okay,
allergens in the workplace, due
okay.
to allergens in the workplace.
Okay. So, who will tell that what is unstable angina pectoris? Anita ma'am. Yes,
Ma'am,
Anita ma'am. Unstable angina.
I, it's like a block in the when arteries,
Which arteries?
uh, like heart, coronary arteries, ma'am.
So how block is happening in all, like in bronchial asthma also blockage is there. What type of blockage?
Plaques, ma'am. Fat deposit, cholesterol,
Okay, so this is unstable angina.
narrowing the. You are asking unstable. It's like occurring for long time, more than 20 minutes, ma'am. It's
And
occurs
what
due
is the main
to
symptoms? Yes.
unpredictable
You're
while
reading,
resting out.
you're reading. I'm telling that the one word I want from you is Usha ma'am will tell.
Ma'am, it's atherosclerosis, basically where there is plague and also there are blood clots. Both
That's
combined is
very
unstable
good.
angina.
That's it. Only this one word I want, plague with blood clots. I told you yesterday, na, only like exact. Wrote many things in this for you to understand. But what exactly you have to answer and what exactly is this? That is very good. Then who will tell that what is stable angina? Sangeeta ma'am. I asked from you only.
Sorry, ma'am, I went to listen to the recording. I didn't attend the
Okay,
class.
ma'am. Okay, okay, okay. Aarti ma'am, stable one.
yes, ma'am. It is predictable. It is the decomposition of the plaques in the arteries,
Yes,
and it is for 5 minutes or more
or less,
or
or
less.
less.
Yes.
Okay. And then what is variant angina?
Yes,
Anita ma'am, will you, if you are,
It's like temporary tightening of that
yes,
blocks,
yes, what
ma'am.
exactly happens with that too? Yes, do you know? Anita ma'am, do you know why you muted?
Ma'am, I can't hear what you said, ma'am.
What is the exact cause for this variant angina? Usha
No,
ma'am, will
ma'am.
Okay. Now it's caused because of spasm. Spasm basically is kind of tightening and
constriction. Constriction.
constriction. Yeah, yeah.
Yes, yes,
So
very good.
constriction, and what happens is ultimately because of that tightening and constriction, the blood flow is reduced.
Yes. So what is another name of variant? Aarti ma'am, will you tell?
Metal.
Metal angina.
Yes, yes, very good. What are the two surgeries I told you for the medical management of this angina pectoris or any of the blockages in the cardiac? Uh,
Stent placement, ma'am, and another one is bypass surgery.
Yes, very good. Very good, ma'am. So, okay. Who will tell what is cardiac asthma? 5 minutes or more, I will complete within that. Who will tell cardiac asthma? Raise your hands. Okay, Aarti ma'am.
Yes, ma'am.
Cardiac asthma. What is cardiac asthma?
Cardiac asthma is like the bronchial asthma, but in this there is the edema. Edema is the fluid filled sacs that are comes from the capillaries when overpressure. Pulmonary hypertension comes. The capillaries leaked and the edema happens um, in the bronchioles or bronchioles. It oxygen is also
Yes.
it consumes the oxygen also in the. That's why
Okay.
the breathing problem is also created in the cardiac
Okay.
asthma because it
Okay.
yes.
Okay. 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 Like you know everything about it, but you are like not able to compile it properly in exact manner. Okay. Otherwise, you know it completely. I understood that. Okay. Anita ma'am, you will tell what is cardiac asthma.
Yes, ma'am. It's a conjection, passive conjection and edema fluid in the capillaries, ma'am.
In capillary, what? Please, can you repeat?
It's in the lungs, the fluid is filled.
Okay. 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 Usha ma'am will tell.
Ma'am, it's basically because of two reasons: is congestion and edema. Edema is where the capillaries leak fluid. So this is happening because of the pulmonary hypertension. Pulmonary hypertension is nothing but the pressure exerted in the lungs. And pressure exerted in the lungs leads to pulmonary edema, where those sacs burst and the fluid gets filled in the lungs. And this fluid makes it hard for the lungs to exchange gases.
Yes.
And the heart can't pump the blood properly to the body because it is insufficient in oxygenated blood.
Yes. Yes. Very good. Perfect. Okay then. What are the main symptoms which are common in like most of the symptoms are common, but main 3 4 symptoms can anyone tell in bronchial asthma and bronchial this cardiac asthma? Anita ma'am, will you tell?
Ma'am, the breath, shortness of breath, with or without that sound, ma'am, seasoning sound.
Okay. Okay. Coughing, wheezing, and the shortness of the breath are the most common form between all. Otherwise, fatigue and all are also there, but these three are very main common. Okay. So with this, I completed with this revision also. If any doubt, you can ask. Otherwise, we'll end the session.
No, ma'am, there are no doubts.
No doubts. You all are understanding.